We're a team of 4 working in the Children and Families Department of Burnley, Pendle and Rosendale CVS. We work with young carers, the Week Out Project and the Female Empowerment Project. We work with young people aged 8 to 18 referred into these projects through a number of channels. This can be social services, schools, self-referrals or any other organisation working alongside children. Myself, Karen and Sarah each have our own area to cover. I cover Burnley, Karen covers Pendle and Sarah Rosendale. Kirsty is an activity worker and puts together sessions for the young people to access, such as crafts, arts, baking and trips, such as to the pictures and other outings. This has been a particularly difficult area to cover during the pandemic and was compromised by walk and talk and Zoom sessions with our young people. This is slowly building back up to arranging group sessions and trips out again. So young carers are people who are referred into the service when they are classed as having a caring role in the home environment. We now only accept referrals for young carers caring for somebody with a mental health and or substance misuse problem. These can include caring for a younger sibling, completing household tasks such as cleaning, cooking, washing and shopping, or being a support to a parent when they're at a low point in their recovery or when their mental health declines. So some issues at school that young carers face: they could be late for school or may stay home because of their caring responsibilities. They may also leave school early to get home to be cared for. It is common that young carers can either be ill through stress or worry, or they pretend to be ill so that they can stay home with the person they care for. Whilst they are at school, young carers may struggle to concentrate. This could be due to them worrying about the person they care for, or because they are too tired to concentrate because of the work they have done and will have to do when they get home. Often, young carers fall behind with homework because of the extra responsibilities that they are taking on at home. Homework is usually one of their last priorities, so unfortunately it means that they don't have time to do it, or it's possibly rushed and they don't try the best. The problems above may lead to the young carer not achieving their full academic potential, which ultimately can have an effect on their adult life. For example, problems in entering higher education or finding work. Young carers sometimes experience problems with bullying because they are noticed to be different from other children their age. They may also lack confidence and self-esteem because they are used to being around adults and sometimes have difficulty interacting with their peers. The workers at the Young Carers Project can help, if a child wishes, by letting the school know about their caring role so that they can be given appropriate support within school. This can often be very important because not only does it mean school can be more understanding, it also means that there is someone in school who can be there for the young carer if they feel they need some extra support, either from a teacher or via the Young Carers Project. They may face the issues at home. Young carers often come from low-income families due to parents not being able to work. The responsibility a young carer can have within a single-parent household is usually greater than if there are 2 parents, which can mean that they are more likely to be a young carer if they live in a single-parent family. Not being able to work or only having one income obviously has an impact on the family's finances. Problems with their health. The responsibilities young carers take on can lead to stress and anxiety. Children and young people feel stressed too, but it can be 10 times worse for them as they don't know how to deal with it in a way that adults do. If the young carer does miss a lot of school, not only are they missing out academically, they can also be missing out on health checks and vaccinations which are generally given in school. It has also been found that they are at increased risk of developing physical and mental ill health themselves. So there's problems with social skills. Young carers may feel isolated from their peers because they have extra responsibilities at home and may not have much time to socialise. This may lead to them being withdrawn and quiet. Although young carers can appear very mature for their age due to the adult role they're taking on, they can also be very immature too. When they are given the opportunity to be a child, it can often mean that they are acting in a very immature manner. This is thought to be because they aren't sure how to act in an age-appropriate way. So how Young Carers Project helps. The Young Carers Project can help by providing one-to-one support, time-out sessions and respite activities. These can help give the young carer the opportunity to meet other people who are in a similar situation to them. One-to-one gives the young carer the chance to talk to someone in confidence about anything that might be bothering them. This in turn will alleviate some of the stress that they may be feeling. Monthly time-out sessions take place in each area with activities such as cookery, games, arts and crafts. Respite opportunities give the young carer a break from their caring role and the chance to do something that they might never have been given the opportunity to do before. This can be as simple as going to McDonald's or the cinema. It does not necessarily mean a fantastic trip to Disneyland. Access to short courses such as first aid, self-esteem and confidence, and adventure services challenge. By providing confidential support, the young carer can grow in confidence and feel assured that someone else does understand what they are going through and that they are not alone. The Young Carers Project can also refer the young carers and their families to other agencies and organisations to give them extra support where necessary. Young Carers workers are able to attend multi-agency meetings on behalf of the young carer and liaise with the different agencies involved. So what support might young carers need? But they need recognition of their role to start with. Then they may need information about relatives' illness. They may need information about other services and how to access them. And they may just need somebody to talk to who will listen and understand them. They sometimes need practical assistance and support and time out for themselves. Assurance that they are doing something fantastic by helping out, as they often don't realise or receive praise. Young carers need to be included in any assessments being carried out, and young carers aged 16 plus are entitled to carers assessment.
The WeCan Project. WeCan Project works with schools, children, social care and families to connect young people in care who are struggling with ongoing emotional support. We provide looked after children with regular one-to-one sessions with an assigned support worker who works towards helping them achieve their potential. We also offer the young people advocacy in situations they feel they need help and can act as a mediator between the looked after child and other organisations. There is no limit to the number of one-to-one sessions a young person can have. However, they must be between the ages of 7 and 18 and must be a looked after child in order to meet the criteria for support. We work with schools, residential homes, children's social care and families to connect young people in care who are struggling to ongoing emotional support. We aim to give young people in care the opportunity to form trusting relationships with their support worker and to strengthen the existing relationships they have with other professionals involved in their care. The Female Empowerment Project, supporting young females at risk of CSE Level 2 on CON. One-to-one sessions can help raising confidence and self-esteem. We think it is an important tool making positive choices. If you have low self-esteem and confidence, you may not take care of yourself as much as you should. It can affect your relationships, particularly in terms of what you are willing to put up with from a partner or friends. When people suffer with low self-esteem, they simply think they don't deserve better. It can also lead to issues with mental health, such as depression and anxiety. Sessions around positive relationships, internet safety and keep safe work. The internet, for all its glory and opportunities, does unfortunately feature threats and challenges. These might manifest as online abuse, bullying, threats, impersonation, grooming, harassment or exposure to offensive and or violent content. Signposting to other agencies, professionals or groups. Confidential. Provide a confidential and non-judgmental approach to our work. A safe space and a listening ear to help work through worries and issues. Advocacy. We can speak on behalf of the young person, helping to put together information from professionals. For each of the services provided, the initial assessment is an opportunity to meet the young person and their family, tell them what the project is and why they have been referred, discuss ways the young person can be supported, gain consent from young person and guardian to use the service. The initial assessment should start with the young person in a one-to-one setting. This could be in school if the young person feels comfortable. If not, this can be at home, the CVS office or community. As part of the initial assessment, we arrange to speak with the parent or guardian separately. It is important that we have a broad picture of what the issues support is needed. The assessment stage of the referral process looks at what the individual needs of the young person are and how these needs fit within the scope of the project. In some cases, the results of the assessment might be that support from the projects would be unsuitable. Some examples of when this might be the case are when the young person decides that they do not want to use the service, the young person presents with needs that prevent them from accessing one-to-ones, the young person is unable to communicate in any way, the young person lacks the capacity to consent to engage with the service. In these instances, the young person might not be registered with the project but can be referred at a later date if appropriate. How do we refer in? To refer to any of the services provided by the Children and Families Department, you can contact us by telephoning the Burnley CVS Centre on 01282 433 740 and asking to speak with a member of the staff who will email out a referral form, or completing a referral form from our website and emailing it back to info@BPRCVS.co.uk, which will then be passed on to the department.